Digital Transformative Dentistry by Dr. Helena Soomer Lincoln, DDS. Technology has opened up new paths for healing, paths that make complete transformations possible in ways that were not even dreamt of just a few years ago. Today, it is possible for patients to go from examination to restoration in a matter of a day or even hours. Transformations that once took weeks can now be accomplished in a single sitting. Let us show you the latest digital tools and how they enable a faster, gentler path to complete healing by following the story of one patient, Anya, who went to Fairy Tale Dental for treatment and found that dental treatment has changed in ways she could never have imagined. When Anya arrives at the dental office, she will do her intake paperwork on a digital device like an iPad. This ensures all the information is available to everyone who will work with Anya. It also ensures that any other outside entities, such as insurance companies, are linked at the outset. Once Anna takes her place in the exam room and discusses her goals for treatment with the dentist, then Anya has a painful back molar. Anya wants relief from the pain and also wants to keep the tooth if at all possible. The dentist has a number of tools to help her evaluate Anya's tooth to determine if the tooth can be saved and how best to do so. Various digital x-rays can be taken. In this case, a full 3D digital scan called a CBCT is taken. This shows the dentist the tooth, its roots, and the surrounding bone from every possible angle. With this digital image, the dentist agrees that the tooth can be saved. Together, Anya and her dentist determine a treatment plan. The tooth will be prepared to have a crown placed on top to restore it and protect and save the tooth. Not long ago, this restoration would have taken weeks. A temporary crown would have had to been created just to hold the patient till the crown could be delivered weeks later. Anya will receive her crown the same day, thanks to the digital tools the doctor will now apply to her case. As we've seen, one powerful tool has already been used, the CBCT scan. Next, the dentist will prepare the tooth. The next digital tool is a wand that is used to scan Anya's teeth, including the newly prepared tooth. The scanner captures the patient's teeth and bite as a digital model that will be the basis for the restoration. This 3D model of Anya's teeth is transferred to an in-office digital design workstation. There, the dentist and a dental technician design a crown that precisely fits Anya's painful molar and works with the other teeth to create a perfect smile and bite. The digital tools allow for rapid design and immediate fine-tuning under the direction of the dentist. This process can be completed in less than an hour, often minutes. The result is a beautiful, detailed restoration that has the fine details of the original tooth. Since Anya went to Fairy Tale Dental for her work during the wait for the crown to be created, Anya can rest in a nearby spa-like setting the dentist has reserved for the patients. This resting space is purposely separated from the dental office to support patients and help them further their healing while they wait for the final restoration. The resting place has yoga mats and stretching equipment, while a fireplace glows warmly and meditation music plays softly in the background. Locally grown refreshments are also available for the patient while they wait. While Anya rests in this cozy oasis, the design for the crown is approved by the dentist and made ready to be milled. Milling is analogous to 3D printing, but in reverse. A block of high-tech material is put into a mill that then carves the designed restoration out of that block using carbide and diamond drills. The mill is essentially a robotic, high-tech manufacturing machine that lives in the dental office. Anya's crown design is sent to the milling software where it is set up for the mill to carve out of the high-tech ceramic block. Once the design is prepared correctly, the block is loaded in the mill and the final restoration can be created. This mill takes about an hour to create this finely detailed restoration. During this entire process, scanning, designing, milling, Anya has only been asked to open her mouth for the preparation and initial design scan. Since that scan, Anya has been relaxing nearby while the digital workflow does its work. After milling, the restoration is polished and glazed in a small furnace, and Anya is brought back to the office. The restoration is placed, and Anya tries it out. She remarks that the new crown hits a bit before the neighboring teeth, and the dentist makes a quick adjustment to the crown to reduce the initial bite. Anya confirms that the bite feels good, and the dentist cements the restoration. It has just been a few hours since Anya arrived, and she is ready to leave with a fully restored tooth. Anya is free of the tooth pain, and her smile and bite are back. Thanks to the digital workflow, Anya's experience was pain-free and very, very quick, and her new tooth is better than it has been in decades.